everyone, welcome to the SolarButterfly studio, and we are in Rotterdam in the beautiful area here, and I'm with Anna Roosendaal.
Nice to meet you.
Very excited to meet you. We have something completely different that nobody in our butterfly has learned about yet, and that's called the Klimaat Dokter. Is that correct?
That's correct.
Why is it called the Klimaat Dokter?
Because the climate crisis is a healthcare crisis, and the healthcare sector is a big polluter in climate change, and those two things don't match. So that's why.
How did you come up with this idea?
I already knew that climate change was affecting health negatively, and when I learned that the healthcare sector was also a big polluter, that just felt wrong to me as a doctor. As a doctor, I strive for better health and not to harm health, which we do indirectly.
Right, so there's a cycle. There's climate change is affecting health, and then in the healthcare, you're creating climate change, and you want to break that cycle, perhaps.
Exactly.
Okay. When did you start this?
I started this 2 years ago, after a year of searching for a way to do something with the worries that I had about the climate.
Are you a trained doctor yourself?
I am.
In which field, if I may ask?
I'm an elderly care physician.
Really?
It's a kind of unique to the Netherlands to have a specific elderly care physician, not only inside of the hospital like geriatrics, but also outside of the hospital.
And how long have you been practicing as an elderly care physician?
I've just finished my training to be a specialist, but I've been working as a medical doctor in the elderly care field for about 4 or 5 years now.
Okay. Now that you've started the Klimaat Dokter, is that something that you do full-time or on the side or mixed, or how do you manage your time?
The last few months I have done it full-time, but before that I did it on the side, and when I start my new job on Friday I'll do it on the side again.
Okay, so you have a new job as a doctor again?
As a doctor again.
Okay, and how many, have you been able to involve others? Is it growing as an organization?
The green healthcare movement in the Netherlands is making a big wave. When I just started out 2 years ago, it was very small, 13 different healthcare commissions, and right now we're at 32 different green healthcare commissions.
Green Healthcare Commission, what is that? What is a Green Healthcare Commission?
For instance, the Landelijk Netwerk Groene OK, which is the national network of green operating rooms. So all operating specialties come together to try and find a way to make the operating healthcare more sustainable.
I see. So I have the feeling there's a lot of, one of the themes I've been hearing in the Netherlands for the last 4 days is a lot of the sharing of know-how and best practice.
Yes.
It just keeps coming up in all the different conversations I'm having, and it sounds like something similar.
Yes, we, about 1.5 years ago, we created the Green Healthcare Alliance, Groene Zorg Alliantie, which has grown into a bigger and bigger network with lots of communication and helping each other out and finding new solutions to problems that one hospital might have, but another hospital has already solved.
Right. Do you have a concrete example maybe of some changes that you've been able to, through this work, or some of the people associated with it, or in the movement that you've been able to, something you've been excited to see change?
One of the things in the green operating rooms, for instance, is the anesthetic gases. The anesthetic gases are a really big
polluter.
The CO2 equivalent. It's kind of methane, medical methane. And there's been a big movement to either switch to a medical alternative that has less greenhouse gases, CO2 equivalent, or to reuse the gases, because you can use the gases that have been used already, you can catch them in the operating room and you can recycle them to use them again. And that is such a big impact, and it's wonderful how that has spread. And
right. Just the awareness and start. I mean, that's what the movement and what we're all about, is getting people aware and thinking about, hey, we're not going to stop doing surgeries, we're not going to stop treating people for health, but how do we do it in a way that we don't harm the environment anymore?
And one of the things I'm also really proud of is we started really small as the Green Care Alliance, and right now they're in talks with the Minister of Health how to incorporate sustainability in the policies for the next 4 years. So we've from a bottom-up movement.
2 years, in just 2 years' time.
Yeah.
Just shows what's possible here. Fantastic. Yeah. You have a British accent, if I may note that. Have you studied there, or what's your background? What's your tie to maybe England?
I've grown up on BBC. That's the short version of the answer. Watching lots of Ready, Steady, Cook.
Really? Yeah, you could have fooled me. I thought that you spent time there, or you grew up partially in...
No.
Okay. It's fantastic to meet you. Is there something you'd like to share with the people watching here, that how they can support you, or what they can do in their communities and places?
Well, I think what my mission is to show my colleagues, but also show the people at home, that you don't have to have a sustainability job to make your job more sustainable. Be the change in your field where you work. And for me, that is the healthcare sector, and for somebody else it might be, I don't know,
fashion,
building, fashion,
right,
hairdressing, whatever. Every field needs to move to a sustainable, needs to make a sustainable change. So be the change in your field.
Fantastic. I love that. Be the change in your field. Here's a wonderful example. Anna, thank you for joining us in the SolarButterfly studio today. Thank you for joining our event here in Rotterdam. Fantastic. We're meeting so many pioneers. We're going to put your picture up here on the wall in a moment. And so thank you again for your time today. And I thank all of you for checking in, and hope that you enjoyed the interview. We'll add all the links below. You can follow us on social media at Meet Larso, and of course at solarbutterfly.org. Thank you, and talk to you soon.